Thank you for calling the Division of Adolescent and Transition Medicine at Cincinnati Children's Hospital Medical Center.
Everett with Ohio for Freedom here. How hard is it in Mike DeWine's, Ohio, to schedule an appointment for a 5-year-old with Cincinnati Children's Hospital's transgender adolescent clinic? Well, as it turns out, not very difficult at all.
We can definitely still get you scheduled in that department.
So I went to dogpile.com. I do not use Google, and I just search engined up Cincinnati Children's Hospital, gender affirming care, and right there in the search results, it said that they treat patients from age 5 and up. So I made the call. Please listen to Pamela when at first she seems a little apprehensive, but then as soon as I mentioned transgender clinic, she got all bubbly, all excited. Here's what it sounded like.
Good afternoon, Scheduling Center. Pamela speaking. The last name of the patient, please.
Robbins.
First name?
Bobby. I'm calling
Date of birth?
I'm calling about a new 5/14/2018. I'm calling about my grandchild. And we're not going to be in the system. I've found you online, and with thank the Lord, now that Governor DeWine has given us a little bit of breathing room, I wanted to just check into how hard it is to get an initial consultation or a consultation for my grandchild.
For what department?
I believe this is the number for Transgender Health Center.
Okay.
And I called the Dr. Leanne's number, but there was nobody answering over there. So if you could just, anyway. But this is just the number that I found for you guys online.
Okay. So we definitely schedule for that. I believe we are booking out until February, early March.
Okay.
And we do have some different locations. We have either the Burnett campus and Liberty. Typically, the first appointment, you're just there to speak with the doctor. The doctor determines whether or not if the patient is, really transgender or not.
Right.
What route the patient is trying to go.
Now, I had concocted a cover story. I actually expected to be questioned. I thought I'd be busted any moment. I didn't need a cover story. This was the easiest thing in the world to do. But what I found very interesting, and I realize Pamela is the scheduler. She's not a doctor. But she did say twice in our conversation, she used the words, what the patient is trying to do, or are they trying to be transgender.
What route the patient is trying to go.
Also, it really gave the strong impression that the doctor would be able to make that determination in just one visit.
Typically, the first appointment, you're just there to speak with the doctor. The doctor determines whether or not if the patient is, really transgender or not.
But you decide for yourself.
Really transgender or not.
Right.
What route the patient is trying to go.
Yeah.
They also refer you out for counseling services if the patient or the family needs counseling as well.
Right.
But that first consultation is basically just to figure out what's going on with the patient, and then moving forward. So we can definitely schedule something if you would like.
Well, let me run a couple things. I do have sole custody of Bobby. Hopefully things will change.
Now, I had concocted a cover story. I actually expected to be questioned. I thought I'd be busted any moment. I didn't need a cover story. This was the easiest thing in the world to do.
With my daughter, at some point, at some point, one of these rehabs has to work, doesn't it? But I've put in a call to HR, so I'm not quite sure where. Like, if I just had to pay, and I don't care. I don't want to let too much time go by. So if I had to pay for that initial consult out of my pocket, I can do that, correct?
Oh, yeah, definitely. You can pay for that appointment out of pocket if we do not accept your insurance.
Right.
Now, cost-wise, I do not know. I would have to get you over to billing. They can give you the full rundown on how much that type of appointment will cost. But yeah, you can definitely pay for it out of pocket if that's what you're wanting to do.
Okay. And how far out are you booked for an initial consultation? I think there's one more call that I have to make. And although I do need to keep my daughter, Bobby's mother, in the loop, but how, I don't want to waste too much time. So how far out are we booking right now?
Give me just a second here. So we're currently booking out into Friday, February the 16th.
Okay.
But our schedule constantly changes. So right now that's available, but tomorrow that may be gone.
Right. But ostensibly, if it's like if I could call y'all tomorrow, probably, and I'm not pinning you down, but probably before February is over, we would be able to get a first visit in, you would think. Is that?
Yeah.
Okay. Miss, and there's so much, this is a little bit stressful, but it's a little bit relieving to make the call. But in a first visit, it's going to be evaluative, right? It's not going to like move somebody this way or that way. We're just trying to figure out exactly what's going on. Is that right?
Yeah, you would just have a conversation with the doctor to figure out what the patient is feeling and if it really is truly, are they trying to be transgender or not?
Is trying to do, or are they trying to be transgender?
And if it really is truly, are they trying to be transgender or not? Is trying to figure out what's really going on. Once the doctor determines that, then you will move on to the next step.
Yeah.
But you're just talking to the doctor, trying to figure out exactly what the patient is feeling and what's going on.
That's completely common sense. And then, my golly, there was one other thing. So, but I can't think of what it is. And here was the thing. So Bobby's next birthday is the 14th of February, and
Okay.
And so that's age 6. So that's not a problem.
So no, that's not a problem. But with the patient being 6, it may want a nurse to schedule that type of appointment.
I see.
So if it does stop one of our schedulers from scheduling, we will let you know, hey, we can still schedule this appointment, but we have to get you over to a nurse.
Okay.
With the patient being so young. So that's a possibility.
Yeah.
But we can still get it scheduled. It's not going to stop anything. We can definitely still get you scheduled in that department, and you can speak to a doctor to get any and all questions answered.
Yeah. Well, I've called a couple places, and so I just wanted to nail that down. All right. I won't keep you on the phone all day. Thank you very, very much, and we'll be in touch. Thanks for all your help.
No problem at all.
Okay,
Have
thank
a
you.
nice day.
You too now.
So in Mike DeWine's, Ohio, you can definitely schedule your 5-year-old who's about to turn 6 for an appointment with the Cincinnati Children's Hospital's Transgender Clinic. And you don't need a cover story, and you don't even have to have insurance. They will take your money. But here's the thing. It's not Mike DeWine's, Ohio. It's our Ohio. Call your state rep, tell them they must overturn this ridiculous veto, and then why don't you call Cincinnati Children's Hospital and tell them 2 things. Number 1, why don't you get back to practicing real medicine? And number 2, maybe some people need to be fired.
I hear the sweet